Hello friends, welcome to ABCD. What's ABCD? Actively building conversation with Dipenism. So this is the first time that I have invited an expert with me. This is my best friend and in fact my expert person who helps me with all my nutritional guidance. So here with me is Dr. Bansi. In fact, I would like you to introduce yourself.
Okay. Hi, friends. I am Dr. Bansi. I'm a wellness coach and a dentist, and I have my own wellness journey, which I call Tasty Fit. Today, we are here to talk about a very important topic, which I think one in every 5 women in India face through, which is called PCOS, or you would also know it as Polycystic Ovarian Syndrome, which is now being renamed. It's called PMOS, that is
That's interesting.
Polyendocrine Metabolic Disorder or syndrome.
Okay.
And
So how does this renaming work? I think this renaming also would help individuals to see this condition very differently, I guess then.
that's very true. So this renaming, earlier the polycystic ovarian syndrome was only specified to ovarian diseases, but now it has been said something like a multidisciplinary aspect, wherein you have your hormonal changes, like your endocrine changes, you have your metabolic changes, and of course your ovarian changes are always there. So that helps people understand the whole disease much better and give them a better approach to how you can go ahead and treat the disease.
Correct. So I want to understand whether this PCOD term is a rightly mentioned or is it a misnomer sort of a thing?
It's sort of a very mispronounced word. So if you say PCOS, it's basically polycystic ovarian syndrome, where you actually feel like there are some cysts on the ovary, right? But actually that's very different. There are no cysts. There are immature follicles, which are very completely different from what the cysts are.
True.
Right? So that's why this new name, the PMOS that we say, or the polyendocrine metabolic ovarian syndrome that we say, is a much better name. Let's break it down. Let's break it down the name. Okay.
Yeah,
so when you
because
say,
it's very scarier. It's a long term.
it's a long term, of course. But when you break it down, you have polyendocrine, which means it's not just about the ovaries, but you have other glands which are involved in it, like your adrenal glands, your pituitary, your thyroid. So it's not just one gland or one hormone that's gone out of tune, but the whole orchestra of hormones have gone out of tune.
Yeah.
Okay. And then when you talk about metabolic, that's what the clinicians see. So you have these weight changes that happen, the insulin sensitivity, and then you have these acnes and hair loss and all that happening. So that all will come in the metabolic conditions. And of course, the ovarian part is always there. But it's not just the leading part of the story. It's just a part of the story and not just the entire story. So you have all the other factors also into it, plus the ovarian part, which is always there. Okay.
So that clears a lot of the perspective around PCOD. Now it's renamed. That means it can be understood as a condition which can be which has to be managed at multiple levels.
That's true. It's a multidisciplinary condition.
Approach.
Yes, yes.
So at the same time, I also understand probably it is because of the initial ways how it was diagnosed. Just the sonography that used to help, and those imaging techniques have improved. So they are not just seeing it as cyst right now. It was a old medical term.
That's true.
And now that is why it has been refined in a better way, so that the condition can be understood in a much better way. So now my question to you is, what is the reason people are getting so much of this diagnosis about this PCOD, or now you're saying it's PMOS?
So one of the main reason why you're getting these diagnoses is because of the environmental factors. Also because of the food that we're eating right now, because of the more amount of ultra processed food, the amount of sugar that is going inside everybody. These food are indirectly causing a lot of increase in the amount of cases or the patients that we see with PCOS, which was not there earlier. Like earlier, the food was much better. The sugar content was very less. Plus, the adulteration in the food was very less.
Yeah, adulteration, that's a huge topic that no one talks about.
Yes. So that's the reason we are seeing a lot of cases with PCOS. And of course, a little bit of the genetic factor comes into picture. But most of them, I feel, is environmental and food related.
Yeah, it's so much inclined with psychology. Like we have certain psychological conditions. We always talk about nature versus nurture.
Correct.
There is the nature, that is the genetic part, and then there is the nurture, that is the environmental part. So this condition also has a genetic predisposition to it, and then there is the environmental part.
And I've also heard where, to speak about your mental health part, I've heard that when there are women who are diagnosed with PCOS or PMOS, like we say right now,
Yeah.
the daughters of those kids are also somewhere mentally affected because they are anxious that those things won't come to them, or anxious about the part where, you know, if it comes, then how will we deal with it, or something like that.
Right.
So that's where I think mental
illness also it comes up. So this, we call it as anticipatory anxiety.
Yeah,
you anticipate something like this would come up,
and because you've seen your mother go through that, you actually know what it is, and it gets a little scary. Nobody denies that.
So but now the way it can be managed is also improved. Our understanding about this condition is also improved.
Yes.
So what are the multidisciplinary parts that you would tell the viewers that okay, this you need to work on?
So earlier, if I give you an example, earlier if somebody was diagnosed with PCOS, they would go to their gynac would give them a pill,
a contraceptive pill
or something like that to manage their hormones, and that was that. But they would not take care of the other problems that were there, like the weight gain is there, or I'm not saying it can only be with people who are fat, it can also be people with all body sizes, right? But the weight gain was one of the issues that we've seen in patients who have. Also, you can also see skin issues like acne have happening, or a body hair, facial hair in girls. And there are other symptoms other than the hormonal part, wherein the insulin resistance or the weight gain or something like that. So they are not being treated or addressed well. So then that's where, you know, when you have a gynecologist or an endocrinologist with giving you medications, but you will also need a nutritionist or a wellness coach wherein they help you with your lifestyle changes, with your diet and everything. You will also need a mental health coach or a psychologist who will help you with your anxiety, your mental health issues. And if you have any, say, skin issues or hair issues, you will also need a dermat. So it is basically a multidisciplinary aspect where you need a lot of people, a team of people to treat your disorder or symptom.
So even then, wouldn't that be financially also exhausting for the patient, because they have to meet so many different specialists?
It may be a little financially exhausting, but I think in the long run, when you see the results that it gives, when you are thinking about, say, conceiving, or you're thinking about a long-term changes in your body, it really is fruitful, and it is something that at the end of the day, health is wealth. So you cannot go beyond your health in any financial terms.
So cost and the consequences, you have to then weigh that. So now when you're spoken about the multidisciplinary approach, how does nutritional part come into the play, and what all things people can do? Like I'm seeing that, as you mentioned, that the lifestyle thing is there. So many teenagers are exposed to junk food right now.
That's true.
So it must be affecting their cycles, their menstrual cycles, and then weight gain and all these issues. So on what levels in terms of nutrition this thing can be managed?
So nutrition, we have three, like you said, the metabolic part of is which we take care in the nutrition part. So in nutrition, we have three pillars for nutrition. The first would be the insulin sensitivity.
Okay.
In most of, like, say, 70 to 80% of the women who are going through PMOS or PCOS, we have seen insulin resistance, be it thin person, or be it a fat person, or be it any body size. They are going through that insulin resistance. So the first thing first, we will be treating that insulin resistance.
True.
So how to treat that? We'll give you some tips. In which I can say that you should have more complex carbohydrates, you should have more of oats, millets and all that. Other than that, have protein and a good healthy fat in your diet in every meal. Okay, not just restricted ke theek hai subah ko kha liya but baki pure din you don't have anything, no protein or no healthy fat. And fat doesn't mean any fat. Healthy fat is very important.
Okay.
So that you eat in each meal. And with that, you also have good fiber and good fruits and vegetables, and that will take care of your insulin resistance.
Okay.
and the most important thing, don't skip any meals. If you skip meals, your cortisol level rises and your insulin resistance goes for a toss. I mean, since you're a psychologist, I'm sure you will agree with how important it is to not skip meals and maintain that regular cycle.
The moment you speak about cortisol, and it's stress. It's about stress hormone, and that is why I mentioned in my book, Why Do We Enjoy the Drama? You have to manage these dramas as well.
Correct.
Because stress has become a routine part of our life now. We have to manage the stress. It's not going to end all of a sudden, and I think we have to toughen up to manage the stress as well.
Sure.
Now, the part that you mentioned about the nutritional part, you have to break it down for me. Like, one, you mentioned that complex carbs has to be consumed.
Yes.
The reason probably being complex carbs are slowly being digested,
so
and
the
energy
glucose spike is less, then that's the reason your body takes time to process the whole thing. You won't feel hungry after every point of time. You won't have energy crash downs, and you will be at a much better place than where you are.
Can you give me an example of a simple carbohydrate which should be avoided? It can be consumed, but as such it has to be avoided.
The most simple carbohydrate that I would say can be avoided is maida.
Okay.
You should avoid that. It doesn't help. It has no fiber. And and complex carbohydrates which I really like are oats, millets. So because all these millets, try and include it in your, like if you're having just wheat roti, I would say alternate it with a millet roti.
True.
Or have some part of millet in your diet that will help you with those complex carbs. And in the long run, when you think about, if you had lunch and then sudden loss of energy if you feel at 4 p.m. or 3 p.m. after lunch, that is what you will not feel if you're having complex carbs and a healthy fat with it.
Now, how do you describe a healthy fat?
Healthy fat can
cheese?
be, the best option of healthy fat can be ghee. Just have a spoonful of ghee with your roti and you are sorted with the healthy fat. Not more than a teaspoon because that has a lot of calories.
Okay.
But a teaspoon of ghee in your healthy fat portion, if you cover it in your meals, then that will really help reduce the insulin spike.
How about cheese? I love cheese.
You can have cheese, there's nothing wrong with it, but the cheese that you see in the market, which right now are all, they are very rich in sodium, right?
Okay.
So you rather go for the natural cheese that you have, like you can have, say, paneer, or you can have cheddar cheese or feta cheese, which is not, which doesn't have a lot of sodium content in it, because that sodium will indirectly affect your kidneys and you won't want that to happen.
Yeah. And probably spike the blood pressure as well, something like that.
So if you're a BP patient, that is of course.
And how does the protein part help?
Protein part, basically, your muscles take up the protein. So they help in reduce, muscles are basically the place where your protein is utilized and your glycogen is stored. So that basically helps in keeping you fuller for a longer period of time. First thing. It takes longer time to digest, so it uses up a lot of your calories as well. So there's something called as TF, right? When you're sitting, thermic effect, right? So when you're sitting and your body is still utilizing those calories, even if you're not walking or anything, your body is still going to utilize those calories. So those calories will increase if you are having more protein.
Okay.
Right. So you will indirectly burn more calories, especially when you're resting and it really keeps you full for a longer period of time. So have eggs if you like, have paneer, have pulses if you like, whatever you're comfortable with, chicken or something.
So ultimately, all these suggestions that you're giving is to avoid the glucose spike.
Yes.
And secondly, you mentioned something about the insulin sensitivity and insulin resistance. Now, correct me if I'm wrong. About insulin resistance, what I've understood is the cells are supposed to use the glucose, and the insulin is the key which helps the cells to open up to receive glucose.
Correct.
But over a period of time, since there is a lot of glucose which is stored, which is unutilized, and the cells stop responding to insulin. So this is the insulin resistance that we are talking about?
Yes. So your body basically develops those insulin resistance because of the high sugar intake, because of the high ultra processed food that you have.
Correct.
And your body then starts reducing the insulin production. So your body is always on a glucose spike. So you have these energy ups and downs, mood swings that
mood swings
so all that can be corrected with nutrition, along with, of course, the therapy that you need.
Okay. So this also means that because of the pancreas have to pump in more insulin, eventually it will lead to exhaustion of the pancreatic cells, the insulin will drop down. So this may lead to diabetic condition as well.
It may, yes.
It may.
Yes.
Because of the insulin resistance, it not
Yes,
resolved.
yes, yes.
I've also heard that belly
So you
fat.
get belly fat increase. You also get, like, if that patient is trying to conceive later on, then the chances of that patient having gestational diabetes also increases to quite a lot of.
Yeah. So gestational is pregnancy-induced diabetes.
Yes.
Yes. It's quite natural to happen. Gestational diabetes, like women will have more amount of consumption of food because the fetal growth is happening.
Not really. Gestational diabetes is morely can be hereditary. Like if you have your parents or everybody has diabetes in your family, then you may get gestational diabetes. The other reason is, of course, stress related. So if you are having a lot of stress, or if you're very anxious about the whole thing, then you may get gestational diabetes. The third reason could be because of obesity. So if you have obesity, if you've not taken care of your weight issues or your insulin resistance before your pregnancy, then you may get gestational diabetes.
Correct. So what I've understood so far is nutritional part has to be managed.
Yes.
There has to be gynecological or the endocrinologist who is working at the hormonal level, and there comes my role, that is a psychological part as well, because anxiety is one such issue. They keep worrying, and when you're mentioning the symptoms about the weight gain or acne, a lot of people come into therapy with body image issues in general as well.
True. And I think one of the main reason happens because the onset, or when you think of the problem that's happening in your body, and when you start seeing the symptoms, that's a 2-year long, probably 1 to 2 year long phase. So in that phase, when the patients don't know what is happening, that's when the mental health picture comes into picture. Correct. Because they're confused with your body, they don't know, they try all sort of dietary hacks to reduce their weight, but none of them work. So I think that's when you come into picture, where you have to.
Yes, because I have to help them with their body image issues. At the same time, how the social media glamorizes thing, that the lean body or a fair skinned individual, and how that is promoted in the society, and that creates a lot of self-doubt in people's mind as well. So I'm not saying it's just in women, even in men, but since we are talking about this condition which is specifically affecting females, so these issues come up, and we will discuss about how to resolve that in the upcoming segment as well.
But I think other than that, there's one point which I feel is a society pressure as well. You know, when you feel that because PCOS or PMOS also affects the fertility or the conceiving part. So that society pressure, and that woman kind of self-doubts herself, that there's something wrong with me, when actually it's just the hormonal issue or some other issue which can be at some point be managed, and could help her with the fertility. So I think that's one of the main thing which you could help.
Yes, because there's a lot of shame associated with all this thing. Fertility issue ho gaya, ya PMOS ho gaya.
A lot of guilt also, I think everybody.
Yes, they blame themselves for having such a condition. And then this is what the intention of this conversation is, that we are actively building the conversation so that we can spread awareness. There's nothing that you are at fault for having. Like, I also teach certain things to my patients, is like, कोई अगर स्मोक करता है तो आप क्या बोलते हो, तो हम बोलते हैं यू आर अ स्मोकर. कोई चॉकलेट खाता है तो हम बोलते हैं यू आर अ चॉकलेटी. कोई स्पाइस खाएगा, यू आर अ स्पाइसर. So sometimes we start labeling a person. Correct. So I think instead of saying I am a PMOS patient, I have PMOS. Something you have it, you can also get rid of it.
You can also manage it.
Yes.
To a certain extent, you
correct. So you don't have to define your identity around it. We start defining our identity with a lot of this thing. So the disease does not define your identity, and a lot of stuff will keep coming in your life, the highs and the lows, and even this thing will have a lot of mood changes as well, because there are hormonal changes. So I've observed mood swings, and I was surprised to see one of the podcasts by an individual, and who mentioned that the reason that once the estrogen level drops, the mood suddenly crashes.
Yes.
And the people around them are not going aware of it. They are not going to be empathetic towards them, and they'll be like, "Arey, iska to ye har baar ka hai." And then probably they don't understand how the estrogen is connected to the mood levels, because the hormone, it's a steroidal hormone, and as you mentioned that healthy fats चाहिए, तो ये सब synthesize करने के लिए you need that nutritional part.
Yes.
And cortisol, then so many other hormones, they are not keeping a balance. So the intent is to maintain the balance
Yes.
of the nutrition, the hormonal part, and the psychological balance that we are trying to strike.
And I think the most important thing is sleep. Okay.
Hmm.
So PCOS, PMOS, or in fact everybody needs at least 7 to 8 hours of sleep, which helps them rest, which helps them, get back to the whole energy level.
Hmm.
And since I think you can explain it better, that it's a cycle. If your
Yeah.
sleep is affected, then your hormones are affected, and eventually again your sleep is affected because of the hormones.
You explained it. I don't know to explain. So she's saying that it's a vicious cycle.
Yeah.
So
yeah.
even with sleep, what is associated is again a hormonal part, that is the melatonin part.
Correct.
And it's called as a darkness hormone. The more you are in the darker environment, the melatonin levels are going to rise, and that is going to induce sleep. It's also called as a sleep and wake hormone. It's a circadian rhythm. And most of the times at night, we are with our phones. And those lights, they disturb your melatonin levels, and that is why the sleep does not come easily. और सब यही कंप्लेन करते थेरेपी में, मैं बहुत सोने की कोशिश कर रहा हूँ, बट नींद नहीं आ रही, नींद नहीं आ रही, नींद नहीं आ रही.
Then you keep on clicking on those reels.
Yes.
And your night is gone.
Yes, and that is where I teach them the paradox in psychology कि आप ये बोलो कि नहीं सोना है. When you try to push yourself to sleep, you won't get it. नहीं सोना है, instead of using a mobile, you get back into reading, read something, or something at night which can a light food.
You can have pistachios, which are very good for sleep. You can also have kiwi, which is called a super sleeper, because it's very rich in serotonin, it's very rich in melatonin, and it's a good folate, so it really helps with your sleep. So
I'm glad she's not insisting on supplements and she's talking about all the natural stuff.
See, supplements, basically, I don't believe in self-prescribing. Okay, you should never self-prescribe. मार्केट में बहुत चीजें मिलती है, बहुत लोग बोलते हैं ये खाओ तो ये हो जाएगा, मैग्नीशियम खाओ, जिंक खाओ, ये खाओ, but you should always do it with a certified professional, somebody who knows what it is, somebody knows how helpful it is going to be for you, and only then you should have it. So let's have natural food first.
Absolutely.
And then go ahead with the supplementation.
Yes, so nature is provided with all the nutrients. It's all about making a choice.
Yes.
I think even managing this condition is about a choice, how you want to manage your nutritional part, your hormonal part, and your psychological aspect. And once there is synergy of all these three disciplines, the ultimate goal is to have a better quality of life that can improve.
Yes. And one more thing is, no two women or their journey is going to be the same. No two women will have the same symptoms, or they will have the same diagnosis out of it. So please don't compare your journey to somebody else's journey. It's not going to be the same. If they're taking some sort of medicines or they're taking some sort of supplements, it may not give you the same results. So stop comparing and just go ahead and do something that will make your life a better version.
Correct. That is what people are not aware in the scientific way, that metabolism itself varies from body to body, individual to individual, based on the age group as well. In fact, some people do not understand the metabolism part as well. It's mainly the breakdown and the synthesis which regularly happens. And what I understand, you can regulate your metabolism to a great extent with nutrition as well as with exercise.
Yes, exercise is very important. See, one thing that I've seen with PCOS or PMOS patients is that if you do a lot of high energy, high intensity exercises every day, it will affect your hormones at some point of time.
Affect as in positively or negatively?
No, negatively. Okay. So high intensity exercises are not supposed to be done every day. They are not good for you. What you have to do is weight training, strength training exercises at least 3 days a week. Okay. And with that, the remaining days, you can do some light exercise like, say, walking, swimming, yoga, whatever you're comfortable with. But 3 days a week, if you do strength training, your muscles are going to be thankful to you. Yeah, they're going to store more protein. They're going to be much more at a better place. And then, uske baad, if you sleep well at night, your body is going to give you the best results possible.
Absolutely. And even I've read that insulin resistance can be managed well with exercise.
Yes.
The more the muscles are built, the better utilization of the glucose. There is no reserves that are just going anywhere in your body. They're going to be utilized better.
I've also heard that yoga also helps quite a lot in treating PMOS or in treating some of the symptoms of PMOS, if not wrong. Like they help in your insulin resistance. They also help in maintaining your hormonal balance, or it also gives you calm, which helps in the mental health aspect as well. So yeah, yoga does help in
Yeah.
some ways. Swimming helps. So
Yes.
light exercises like yoga, swimming definitely is a boon,
Right.
but strength training is a must.
It's must. Okay. I give a simple meditation technique.
Breathe in, breathe out.
We had this conversation for 10-15 minutes and we forget to take deep breaths
Yes.
because we are so much involved into a conversation. Camera dekh raha hai, log kya sochenge. At so many levels we are thinking. There's no pause.
But it's also something that we both are, I think, that passionate about, because
True.
we both are so much passionate about, like, I am very passionate about my nutrition part, you're very passionate about mental health, and we both actually want something good for our
Yeah.
patients or clients.
Yes.
And that's the reason
Okay.
we are talking that
True.
well
So
about
how do
it.
you pause in your life? What's your way to calm down yourself?
I have a kid. I
You're a
can't
kid.
pause.
Oh, perfect. She can't pause. Super mom.
No.
So how do you develop this amount of energy to manage? What's your
Eating well, exercising well, and just maintaining a positive outlook to life really helps.
yes.
And having supportive husband helps a lot.
She has a supportive husband. That's
Yes,
great.
I do.
Okay. And in fact, this is also a fact that exercise helps to boost endorphins.
Yes.
And endorphins are a happy hormone. They improve your mood as well. So all these things, small steps are going to help. Instead of perfection, we have to focus on consistency.
Yes.
People also have binge eating issues. They have cravings and then they feel, "Arey, everything is ruined. It's a disaster." But then it can happen. What I would also insist is to maintain a journal to identify your triggers.
That's what I do with my patients as well. I
Wow.
tell them to maintain a journal. Every day, what you have eaten, please write down in a journal. You see for yourself what changes you are doing for yourself, and that is going to help you. And I think that is going to help them in their mental journey
Yes,
as well.
yes. We have to identify the triggers. Sometimes the mood is low, कहीं पे office में कुछ हुआ है, किसी से झगड़ा हो गया है, and then we do stress eating because food changes your mood.
Yes.
But Dr. Bansi has said it has to be a healthy food because otherwise, on a broader aspect, it is going to affect your physical health as well.
That's true. You have these swaps that you can make if you are having chips. Swap for a better food like, say, peanuts or roasted chana. So
Correct.
these simple swaps, I think, can change your mood as well as not affect your health.
Okay. But I'm getting a feeling, are we making it too simple? Okay, but if gynac, nutrition, psychological, it must be so tough for women. So
Please.
how can we help them with this? Would it be a lifelong battle, or do you feel it can be resolved and with some?
See, I'm not saying that it can be totally resolved or it can be totally overcome, but if, of course, there's some support that we can give them, like an endocrinologist can give them a hormonal support, which will help them. A nutritionist can give them a lifestyle support, which can make their lifestyle a little better, which can make their, say, weight gain issues, which can treat them. And a mental health perspective, a psychologist can help them with a balance in their mind, their mood swings, and how the guilt, fear, shame, whatever they're feeling, those feelings can be handled. So basic point of all this is that you can give them a better way of life, but to treat it properly and to treat it completely, that is going to be a little difficult, but definitely a better and a positive way in life can be done.
Yeah. So there has to be willingness, and you need to actively participate, and we all have to take our individual responsibilities. This is what I tell all my patients. If
And
there is no willingness, consistency
very
that is
important.
there.
Like pura week you've done everything properly, and then weekend aake pura week ka you mess it up, and then you realize, अरे छोड़ो, मैंने तो खा ही लिया है, तो और 2-3 दिन भी खा लूँ. नहीं, leave it. You've done that, forget that portion, and then get back to your routine which was helping you.
True.
But don't forget, don't just fall into that circle, where you keep on spoiling things for yourself.
Because I've observed that what happens with people is, अगर मैं बोलूँ कि किसी और के साथ ये अगर condition है, तो उनको क्या बोलेंगे, अरे नहीं, you can do it, come on, we encourage them. And जब खुद के साथ होता है, then we start criticizing. So this is the quality. The quality that is missing is compassion. People show a lot of compassion towards others, but towards the self compassion is missing. And फिर मैं बोलता हूँ पेशेंट्स को, भाई self compassion दिखाओ, self compassion. बट लोगों को समझ में नहीं आता कि पूछे कैसे सर, कैसे. So I'm waiting for that
That
awakening.
question to come.
Yes, that how to have a self-compassion.
Love yourself more than
Yes.
anything else.
True. And how to love myself? That again a question comes. So
That can be best explained by you.
yeah, so certain simple acts can help, and for that you have to take therapy. You shouldn't
To
be
break the
ashamed.
pattern.
Yeah, to break the pattern, you cannot be ashamed about it, and that is why I share about my phase of depression as well. I have not been in depression. I've grown out of depression, and that is where my affinity for psychology improved. And everyone has their personal experiential learning. In fact, I think that all those females who have PMOS or PCOD or whatever it is, you should be a role model for others as well, because future generations are going to require the guidance more.
Yes.
Because I don't have PMOS, I can empathize to an extent, but then how you are facing your journey, how you have overcome that, you should be role models. That is a good motivation to have.
Yeah, you should be role models to the coming generation, to your coming
Yeah.
daughters or nieces, or the coming generation. You have to be the model, and you have to show them that you can overcome it, you can manage it, and you just don't have to live with it. That's how it is.
So that is our ultimate goal. I think we can wrap it up on this
Yes,
positive
yes.
note. So that's all from our side. Actively building conversation with Dipenism. And if you have any questions, any queries, if you would like to get in touch with the owner of Taste of It, Dr. Bansi, or with me, you can message in the comments, and we'll pin the emails as well.
Yes.
Thank you.
Thank you.